I am Dr. Murli. I am an intensive care physician working here in the KIMS hospital for the last 2 years. Usually if a device fails, most of the time it will be alarm failure, and it will be informed to the team leader who is the nurse in charge of the unit, and he will telephone to the biomedical engineering group, and within 60-70 seconds, within a minute or so, the team will be arriving here. So that meantime we will be ventilating the patient with the manual ventilator. We need minimum downtime, and the portability as well as reliability is also very important for us.
It's like a 24/7. Its hospital functions 24/7, and the technical support also has to be 24/7. We have around 3,000 assets across the various organizations that we have in Kerala, and we manage the entire systems here as a centralized clinical engineering department. We categorize the machines into 3 categories: the high risk, the medium risk, and the low risk. The high risk are the ones which are actually very risky for the patients in terms of patient safety, the user safety, and also very critical in day-to-day functioning of an hospital. We have asset management software wherein we track the right from the complaint log up to what all spares have been used, the consumables used, the accessories used, and at the end of the day what we do is make sure that we at least achieve around 98 to 99% of the uptime. The equipments we actually maintain in-house because we did not have a proper support from some of the companies. But companies like Dräger realized that the high-risk equipment has to be maintained with the proper support. We do the first level of troubleshooting, and in support, if the matter has to be escalated to the company engineer, we get it support from the engineer. The first level is actually we get a guidance over telephone, and if we are not able to get it done with the telephonic guidance, then we request the engineer to come down, and they come down and support us with the activities over here. So they do the further troubleshooting and assessment of the failures.
Since we are dealing with critical care equipments, it depends on somebody's life. So it's very important to keep the equipment up all the time. So we are doing the planned preventive maintenance to maintain the equipment and stops the equipment for any unexpected breakdowns. Service means providing solution for the end user, the doctors, the clinicians, in terms of clinical application training, providing solution for the hospital for the infrastructure installations like our pendants or any other devices. We carry tools and service software for checking the device and downloading the error logs, so that we will get a clear picture of the sensor values, offset values, so that we will rectify the problems in the devices. Maybe if that is a user end problem, I'll have to visit the ICUs and train the doctors or the staff nurses who is using the equipments. Otherwise, if there is a problem inside the equipments or any PCBs or any component failure, we have to take the equipment to the biomedical department. So from biomedical department we are checking the equipments.
We have a good number of equipments from Dräger, starting from the ICU ventilators, the anesthesia workstations, the neonatal high frequency ventilators, the MRI compatible anesthesia workstations, and also we have a lot of ICU pendants and the theatre pendants installed in our hospitals. We are actually having a preventive maintenance contract with Dräger under the category preventive care. Dräger engineer is actually positioned in Trivandrum, and we also get a 24/7 support from the Dräger engineer, irrespective of the time, whatever time we call, he is readily available. And they also have a very good logistical support in terms of making our space available for troubleshooting or repair works, and the whole effort helps us to maintain the uptime of the machines and at the maximum.